My name is Mike Verbsky, and I am the Director of the Inpatient Rehabilitation Program and Outpatient Support Group at Momentum at South Bay of Paragon Health. I hope you enjoyed last time hearing about emergency preparedness. Today, I'm going to discuss with you about phantom sensation and pain. We will talk about what these sensations are, what they mean for you, and how you can manage them. Phantom pain refers to ongoing sensations, sometimes painful, that seem to be coming from the part of the limb that is no longer there following your limb loss surgery. Phantom sensations or pain are thought to be a result of signals coming from the residual limb hitting the brain or spinal cord. Because people are complaining about pain coming from a limb that is not there, they are often reluctant to mention these sensations, fearing that they will be ignored. However, what you need to know, and always remember, the limb is gone, but the pain is real. The sensations you are feeling are real. For those of you going through your journey, there are many possible symptoms of phantom sensations you could experience. Some of these symptoms include a tickling feeling, cramps, a shooting, piercing, or stabbing pain, numbness, cold, warmth, tightness, or itchiness. So these sensations are a normal part of the healing process. They are real and manageable. The key is communication with your healthcare team, your doctors, therapists, and prosthetists. There are medications as well as non-medication options available to you to help control the phantom sensations. Some of the options that are available to you are medication management, such as acetaminophen, non-steroidal anti-inflammatories or NSAIDs, opioids and narcotic pain medications, antidepressants, anticonvulsants, beta blockers, and muscle relaxants, just to name a few. But there are also non-medication management, such as acupuncture, massage of your residual limb, the use of a shrinker, repositioning of the limb by propping on a pillow or cushion, mirror box therapy, wearing of your prosthetic device and increasing your mobility and activity levels with your device, biofeedback, TENS stimulation, virtual reality therapy, imagery, and music therapy can all be options for you. No one treatment is the answer. You should work with all the members of your healthcare team towards finding the best combination of non-pharmacological treatments along with medications to treat and manage your symptoms. This is also an opportunity to speak with your local support group and other people that have gone through limb difference surgery. They may have another trick up their sleeve that might help you manage your symptoms. Points to remember: throughout your journey, phantom limb sensation and pain is common for most people after amputation surgery and is a completely normal part of the recovery process. Don't keep these symptoms to yourself, and keep transparent communication with all members of your healthcare team, as they are manageable by either medications or non-pharmacological methods, just as I mentioned above, and they should not overwhelm your life. You should work closely with your healthcare team to create and maintain the pain management plan that works for you. Not every option out there works for every single person. There will be some trial and error involved as you find the individual plan that you like. Again, my name is Mike Verbsky, and I'm the Director of the Inpatient Amputee Rehabilitation Program and Outpatient Support Group at Momentum at South Bay of Paragon Health. If you have any additional questions about phantom sensations or pain, make sure to reach out to the members of your healthcare team. There are also support groups available to you at 3 of our Paragon facilities: Excel in Woodbury, Limbrook Rehabilitation and Nursing in Limbrook, and Momentum at South Bay in East Islip, New York, if you are looking for additional support. For more educational videos, check out more at www.paragonhealthnet.com. Thank you for listening for a few minutes, and we'll see you next time.